Hello and welcome to this discussion that is being hosted by the Trinidad and Tobago Healthcare UK Forum, especially for World Mental Health Day 2020. And during this discussion, we are going to focus on two particular concepts: kindness and empathy. Of course, we can't have any discussion during 2020 without some reference to the coronavirus pandemic. And I would say, on my reflections, with all the trauma that we've all been going through, perhaps one of the rare positives to come out of this has been the number of times we're highlighting those random acts of kindness by strangers. But that's got me thinking, in the delivery of mental health services, should kindness be received as a random act? Or should this be something that we should really all be expecting? There's one question to throw out. Then there's this issue of empathy. I don't think there's anybody that can say they fully understand what this virus is about and how it can be managed. But there's an outpouring of sympathy for the impact it's having on so many people, which leads me to think a little bit about these soft skills, as we call them at times. Empathy, sympathy. In the delivery of mental health practice, I wonder whether occasionally these two things get mixed up and whether we perhaps need to be clearer as to what we mean and how we put those into practice. I'm Steve Morgan. I'm a case manager. I'm an occupational therapist, and I've been involved with mental health services, working in them and alongside them in the UK going back to 1985. I set up my own practice-based evidence mental health consultancy back in 2001. And these are concepts and values that have been very important to me throughout all of my practice and my support for other practitioners and people delivering services. But more importantly, I'm joined here today by three esteemed colleagues, and I'm just going to hand over to each of those individually to just introduce themselves, give a little bit of background as to who they are. I'll start by asking Carol Ann, can you tell us a little bit about yourself and also perhaps a little bit about the aims of TTHUF, the Trinidad and Tobago Healthcare UK Forum? Carol Ann.
Thanks, Steve. So I'm Carol Ann Murray, and I trained as a nurse, a mental health nurse, and on completion of my master's in health promotion, I worked as a mental health promotion specialist in public health. I have extensive experience in primary care mental health, and in setting up psychological therapy services for common mental illness, and that can be delivered either online or face-to-face. I currently work as a strategic commissioning lead for learning disabilities and autism. I am pleased to say that I am the mental health trustee for the Trinidad and Tobago Healthcare UK Forum, also known as TTHUF. TTHUF was established by a keen group of Trinidad and Tobago nationals 3 years ago. So Trinidad and Tobago nationals living in the UK, that is. So, and TTHUF became a registered charity in England in June 2019 and is formed of healthcare and other professionals who are committed to supporting safer and more effective healthcare service provision. So at TTHUF, we believe that healthcare standards must be improved so that people receive care that is safe and effective. We are committed to working in partnership, and we believe that high standards of care should be provided to all. So in terms of World Mental Health Day, we wanted to celebrate and mark World Mental Health Day in Trinidad and Tobago, and our intention was to be there. However, the current world pandemic has created an opportunity for us to use online and digital technology to have this discussion. So we are going to discuss a bit about kindness and empathy in this discussion, because this year the theme is around mental health for all, greater investment, greater access. And that's a very broad thing to cover. So we chose kindness and empathy as we think both are needed in these times. And it's needed whether you are in clinical practice as a healthcare professional or just as a human being. For we know, according to the World Federation for Mental Health, and I quote, "The world is experiencing the unprecedented impact of the global health emergency due to COVID-19 that has also impacted on the mental health of millions of people. We know that the levels of anxiety, fear, isolation, social distancing, and restrictions, uncertainty, and emotional distress experienced have become widespread as the world struggles to bring the virus under control and find solutions. So we hope that in this discussion, particularly about kindness and empathy, that we can explore how we can do our part in these current times.
Okay, thank you, Caroline. Can I introduce Rosalind? If you could tell us a little bit about yourself and also your role in TTHUF, please.
Hi, my name is Rosalind Phillips Macmillan. I am a trustee on the board of the Trinidad and Tobago Healthcare UK Forum from its inception. I have got extensive experience in general nursing. I had the privilege of assisting in coordinating a medical acute admissions unit, 72-bedded ward, and also I am presently a pre-assessment nurse coordinating, as looking at patients from a holistic point of view in my role. We know it's World Mental Health Day coming in October, and I would like all citizens of Trinidad and Tobago and those in the UK and wherever worldwide that who would be listening or hearing this webinar. A lot of people that we know have been affected by COVID-19. Prior to COVID-19, we know a lot of people have a lot of fears and anxieties. And I'm hoping that through this webinar, we would be able to look at how we can show empathy and kindness, which can go a long way. And hopefully at the end, some of these, a lot of the perspectives that we look at can be taken away and, used in our everyday caring for patients.
Okay, Rosalind, and your role within TTHUF?
My role within TTHUF is a trustee on the board.
Okay, thank you very much. And Kurt, can you introduce yourself and what your role in TTHUF is?
Evening all. My name is Kurt Hunt, and I am bringing to this discussion today some 30 years and more experience in mental health field. And that has taken me across maneuvering inpatient, community, and public and primary care settings. At the moment, I am responsible for placing mental health staff in GP practices. So again, the focus being about how we narrow mental health issues back in the community. There's this saying that I hold on to, that if the community is seen as part of the problem, it should be seen as part of the solution. So hence the reason why I think that the primary care focus is crucial to this issue. In terms of TTHUF, I am the lead for primary and public health, and that post I have been in since the inception of TTHUF. Okay. One of the things I wanted to say in terms of this discussion today, and a lot of my colleagues have already said it, it's about we cannot have these discussions about kindness and empathy without focusing on what's been happening in the world today. As we sit today, we're looking at the second surge of the COVID-19, and that again is throwing up a lot of issues for a lot of people, issues around worry, anxiety, pain, concerns. So for me, engaging in these discussions around empathy and kindness is crucial to how we begin to think about how we deliver care to people who are really, really, I will say, become disheveled and I will say become a bit unattached based on the fact of the COVID-19. So I'm looking forward to this discussion all.
Okay, thank you. Right. Before we go into a more general discussion, I'm just going to come around each of you again and just ask, we've set up these two words, kindness and empathy, as the main focus for the overall discussion. I'd just like you to share, each of you in turn, what the meaning is of those two words to you, and also if you have any very specific experiences or examples of those, positive or negative, in practice. So let me start by coming back to Carol Ann again. Can you share with us your thoughts about the meaning of kindness and what the meaning of empathy is to you in your practice?
So kindness to me is being available to help others. And I guess as a result of that, helping yourself through this life. Kindness is about being kind to others, is making a difference in someone else's life, being supportive, being caring, and dare I say, being loving. So kindness, I think, is something, it's like a life skill. So I think it's something that we need to look at what we can do about that. Empathy, on the other hand, I think is about listening well and acting with sensitivity to others. It's understanding what it is like to be in someone else's shoes. And I think I have experienced kindness in my work life and home life generally. So I think there are two things that you can use no matter where you're situated in your profession, or just as I said before, as a human being. So I think that is for me what kindness and empathy is about.
Sure, thank you. I think that issue of listening is going to be a very crucial thing that we want to emphasize for practitioners, but also I hope we'll come back to that idea as to where it comes from when you talk about your home life as well. So we're not just talking about specifically being a practitioner. Thank you, Caroline. Rosalind, if I come back to you, what do kindness and empathy mean to you?
Okay, so kindness and empathy for me is they are prerequisites for me for anybody who are doing any type of nursing or home care, or it doesn't even have to be mental health. A lot of patients face their journeys, and they have so much uncertainties. They have a lot of fears, anxieties. And as clinicians, I think a lot of us have got, that empathy and that caring within us. It is learned, and some of us has got it from our moralities, from our upbringing. And we need, within the patient's journey, for me, is to allay their fears. We need to be non-judgmental of what we think that the patient may be thinking or experiencing or so. And also we need to have mutual respect from each, and so we would gain respect as well, and we would understand the patient better. So for empathy, we have to go that little extra mile, understanding the patient's circumstances, putting ourselves in what we think the patient or what the patient have said to us that they are experiencing. And then we can begin to understand and show kindness, show, reducing their fear and just being mindful of what that person may be going through. So and this is worldwide, this is not just for people who in the UK who might have had that, extra training. This is for my colleagues back home in Trinidad and Tobago as well. If we go that little extra mile, understanding the patient's journey and their circumstances, what they're feeling, then I think that we can begin to, understand what is empathy, what is kindness, and our actions can become doing actions.
Thank you, Rosalind. And again, I'm struck by when you're mentioning how people have fears and anxieties, and the way we respond to those could reinforce those, or the way we respond to those can be far more helpful. So thank you for that contribution. Kurt, over to you. what's your definitions of kindness and of empathy?
Um, I, I hold on to these two words quite closely to my heart because I do have the background training in psychotherapy. So once you have that sort of client-customer interface, and that straddles across the board, you tend to think about kindness. And kindness to me is a quality. It's a quality of being gentle, being caring, and being helpful. So especially again when you see a lot of people who are stricken with the COVID-19 and they're in hospital, these little acts of kindness, trying to be helpful, trying to be supportive, just trying to offer some level of care, being gentle, it goes a long way in terms of supporting their recovery. So for me, it's very much around that customer service interface, and we are all users of services. So for me, that goes across all board, and that could work very well other places like in Trinidad. In terms of empathy, I think for me it's the ability to share the feelings of others, and I think there's a bit of imagination that comes with that. So you're able to walk in someone's shoes to get an understanding of what they're going through. As my colleague just said, getting to understand some of their anxiety, their pain, their worries, and their concerns when they're going through a difficult period. And for you to really begin to understand that and appreciate where they're coming from, being able to put yourselves in that person's shoes. There's also three elements of empathy that I came across when I did some research around this word. And there's the cognitive aspects of empathy. So it's about what's going on in your thought process. What are you thinking when you are having that interface with that person in that particular situation? It's also the emotional aspect. So whether or not you're able to tune in at the feeling tone of the other person. So there's the emotional aspect of empathy also. And there's also the compassionate aspect of empathy. So again, it's about how you convey that level of compassion across to one person, being there with them, able to try to understand what they're going through. You're not there, but you'll be able to try to understand what they're going through. So for me, those are the crucial issues for me in terms of trying to unpick those two terms, kindness and empathy.
Okay, thank you, Kurt. I have to say that I'm pleased to say there's a remarkable degree of agreement across all of you in terms of how you describe these two concepts. So I want to throw this open now for a bit more of a general discussion around them, but I do want to focus it at perhaps a couple of levels. What I'm hearing from you is that we're talking about some almost natural innate qualities or values that people hold. And one or two of you were alluding to where those came from, whether that was from your upbringing, whether that's from your home life. So I suppose one area that I'd be interested to hear your views, and I'm going to throw it more open rather than come round each of you individually, is some people have it, some people don't have it. Some people think they deliver on these kind of values, but we might often find that the service users or the carers are not experiencing the service in a kind or empathetic way. So are these natural values that people have, or are these values that maybe people can be focusing attention on, developing, staying away from the idea of training, but that can be worked on and developed? Let me throw that one out first. Whoever wants to pick that ball up.
Okay, so I would say kindness and empathy. For me, I'm going to give my sort of perspective on it. In my upbringing, kindness and empathy is something which kindness and empathy is something which was sort of not instilled but taught in upbringing. So my parents was my role models for empathy and kindness, and I knew from an early age where I wanted to go, the journey that I wanted to take. I got there a little bit late, but I got there. And then I was in that privileged position of passing on this learned and taught knowledge to like students whom I've mentored. And as I said, it's got to be a prerequisite for your nursing. In my everyday work life now, when I am assessing patients, we do it from a holistic approach. So therefore, you not only look at what the patient is going to be undergoing, you look at that whole journey, and then you are able to pick up certain pieces, and doing a simple thing like delivering a sort of, okay, let me say, for instance, like you undertake a patient's, whether it's their observations or you have like results for them, or they are going to take a diagnostic test, just not just sending them on a journey to just find wherever, but kindness can come in that when you just go, as I said before, the extra mile, and you take that person to the destination. And the person, the anxiety and the fear that the person would have felt before, to me, they are much more so open to the kindness that you've just done, that you relieve some of the fears, you relieve some of the anxiety that they would have had.
Let me throw it open to the others as well, just to think in terms of, is that something that people either naturally have, or is that something that we can really develop in all of the practitioners in Trinidad and Tobago, all the practitioners in the UK? Let me throw that out to Caroline or to Kurt. Is this something we can develop in people?
I think from my experience of kindness and empathy, or I guess the reason, for instance, that I became a nurse was based on, I guess, my personal experience, and I knew from a young age, when I was about 18 or so, that I wanted to become a nurse, and a lot of it was about being able to help and work with young people, because I realized at some point in time that I was extremely fortunate, and that I had experienced a lot of kindness in my life. And I suppose I was always someone who would be able to, people would talk to me and tell me things, and I can, listen. I guess maybe I was a good listener, give a bit of advice too, but I was a good listener generally. But I think for me, kindness is something that develops because of probably your experience, or the experience of kindness. Because I think, some people's definition of, some people might think they're being kind, as you said earlier, but the way that is experienced isn't that. So I guess the test of your kindness is about how others experience you, your kindness. So I wouldn't say that, oh, I'm kind. I think other people would be the ones who would say, because they've received whatever I've done or said, or as a kind act. And I think that empathy is something, that whole being able to understand where people are at. You need to meet people where they are, because people are at different points in their life. People are, maybe okay one day, but something happens that totally, destroys their world as they know it. So you need to be able to understand that that what this person is experiencing is important, it's real, and that you need to be able to walk in their shoes a little bit, look at it from their perspective.
Kurt, we've all experienced some of those practitioners where we know they really don't get it. What do we do with those? What do we do with those people? I know what we might like to do with it, but what do we actually do with people who think they're doing it but clearly don't get it?
Well, just to go back a bit in terms of the argument, is my colleagues are already touching on it, that we are a product of our environment. And there's this big dichotomy about nature versus nurture. So again, my colleague was saying that her environment where she was brought up is very much about being kind to others. It's very much part of some of the religious scripts that you come across also. Do be kind to others and others will be kind to you. So there's all these issues around how we look at kindness. I was wondering, is this an innate quality? Yeah? Or do we have it in various degrees? which comes back to your point, Steve, about then how do we nurture it? How do we manage it? Especially when we have, again, if you're working in the nursing profession, you've got student nurses, but I'm just talking about generally out there in the customers. Like you're going into a grocery shop and you're going to buy some shopping, that sort of interface you have with the customers. So for me, it's about checking that out, about this nurture versus nature. The other thing I wanted to say about that also is that I am not too sure, again, whether or not we do have it, because we all know about there's a lot of horror stories out there. I think sometimes people might have good intention, but it doesn't manifest in that way. And then you question their kindness and their empathy. As part of a nurse and looking at a nursing council, an NMC, it's very much looking at all these disciplinary hearings we have for nurses who are negligent in terms of their practice and the impact they're having on service users and their carers. So for me, I still think that that's one I would like to explore a bit more, this idea about something, either you have it or you don't, or how you nurture it, nature. So it's quite an interesting that dichotomy.
I think it's interesting where you drew that parallel in a sense of going to the grocery store. Because, yes, if we go to the same grocery store for time after time, there'll be certain people serving and you're just really pleased to see them. Their smile lights up and it lights up your day. And there's some other people that are serving and you think, oh no, not them again. And the danger for me is that in mental health service, for service users, that's what they have. They know there are some people they think, oh, I'm just glad I'm seeing so-and-so today, or oh, not that person, not them again.
Yeah.
And that's why I think it is something that's, yes, to me, it is innate. There's the nature and nurture that you've all been discussing, and maybe you're the wrong people to be asking because you've all got it as your natural instinct. But we really do need to be finding those methods, those practical ways of encouraging others who haven't quite got it. Because, as I said in the introduction, it should not be a random act. For a service user in mental health services, kindness should not be a random act. So
it sounds as,
yeah, go on.
See, it sounds as if there are different brands of kindness. From what you're saying, it's like they're different brands. So there's this brand of kindness, and there's this other brand of kindness. It's interesting what you're saying, Steve.
Yeah, indeed. We won't have time to really go into depth, but I think we've raised a number of issues there that are very important. Where I will take it just a little bit further is if we've got practitioners that say, one or two of you already mentioned your psychotherapeutic background. What about the practitioners that say, well, I do it anyway, and just all this talking about it that's what academics do. That's what they do in psychological services. We just get on and do it. Is that a defense mechanism?
Oh. Well, you mean with regard to kindness, a defense mechanism that they is that to defend their brand of kindness? Because I suppose there's that thing about some people think that the way that you're kind, some people, there's kind of harsh kind of kindness. They might be strict, but they think that is the way that I have to sort of be harsh to be kind, or to be to the point, to be inflexible because boundaries are needed. So and that is some people's experience of what kindness, because they're doing this so that things will be better later on, or for whatever justifications. And I suppose that's why it's really important how kindness is experienced by the person, because we have these different brands of kindness or definitions of what it is to be kind. So I think, yeah.
Yes, there's that phrase that gets kicked around a bit, you've got to be cruel to be kind.
Yes, and
that comes to mind as you,
that comes to mind, and you said it, and for me, there are levels of cruelty again. So then you need to think about what it is people are doing, what their actions say about them.
Thinking again, just staying with that theme just for another moment, but the idea of, in certain circumstances, we do need to be more restrictive with people. I'm thinking about those occasions where sectioning under a Mental Health Act, for example, so depriving people of their liberties. Has kindness and empathy got a role to play when we're actually delivering services in those ways? Is there can there be an element of kindness in how we go about being more restrictive?
Well, again, I guess what I'm sensing is that we're beginning to touch on, in certain organizations, they incorporate these words or similar words into their values, their core values. So again, when it comes to things, for example, like the Mental Health Act, there is expected behavior, which is aligned to the trust values. But I still think that there are conflicts in terms of, we all have our personal values, we have our professional values, and we also have the corporate values that the organization that we work with. I mean, as you probably know, over the last 10 years, a lot of these organizations have had these keywords: compassion, consistency, empathy, as part of their core values. But again, how is that delivered from being a trust core value into what happens when you have that interface with service users, carers, and their significant others? So yes, it's good to have those values, and it's there in the mission statements, it's there in part of the strategic thinking for the organization. But when it comes down to the everyday delivery on the shop floor, are we seeing that? And are the customers and the service users getting the best of that?
I think when you're talking about people being in the Mental Health Act and things like that, I think when you're talking about people who might be vulnerable and you're using, say, for instance, the law, whether it's in the UK or it's in Trinidad and Tobago or beyond, wherever, once you're using the law to, say, detain someone, and it's usually for their own safety, safety of others, that sort of thing. And remember that if we are talking about mental people with a mental illness, then you need to think about, the law allows for certain things to happen. But I think it should be beyond that, because even if you're having to detain someone or restrict their freedom and liberty, there's a way of doing that. And for me, that is where kindness and empathy comes in. It's about being able to make those, I think, reasonable adjustments wherever that person is. And you can show kindness in making those adjustments. So not because my freedom and my liberty is deprived because I'm, say, on a section of the Mental Health Act or detained legally, that I cannot be treated with kindness and empathy.
Absolutely.
Also, so I think we need to make some of those distinctions when we're talking about restrictions and because it's a key part about how we treat others.
Sure.
So I think it's a fundamental thing about being a human.
I agree, absolutely.
Sorry, Ross.
Rosalind?
I was just saying, also, people for me have got like different levels of what they think empathy and kindness is. But I think where it is extremely important is patient satisfaction and patient feedback. And then having patient satisfaction and feedback, we can then say, oh, yes, we are being kind, we are empathetic. And that's where organizations can now, they would know what type of systems to put in place. Does the staff need more training, in order to show if who are not showing it as being nurture or having it as their core value, put the systems, and the systems are in place to train staff, in order that they can improve patient satisfaction and users, So that's my take on it.
Thank you. Before we come to some key messages to take away, Kurt, you were picking up on an important point there about value statements, mission statements, policy statements. Organizations, certain, I'd say across the board, healthcare organizations do seem to enjoy producing a lot of these great big documents. how much do these documents really have an impact on the front line? And I'm playing devil's advocate to a certain extent. Do practitioners really have the time to be reading these mission statements and the never-ending reams of policy statements?
Well, I suppose as an organization, you need to have some basic principles. So as a healthcare organization, there are certain things that you expect as a basis. So the policies that you then have will reflect that. I mean, people coming to work for an organization need to be, I guess, inducted, and so they understand what is allowed or what is not allowed. And I think by having clear guidance, clear policies on what is to be expected, you treat people with a certain basic level of care and service. So it's you are effectively, as a healthcare professional, you are serving others. You're in a service industry. So I think the organization needs to make it clear as to the basic standards that are needed in an organization, and a lot of those basic standards will deliver, I guess, the basic things that you need for to be kind, to be a caring, to be a listener, to be the things, to be available to help others. So I think the basic things is what we're looking at.
Okay.
And then you can go the extra mile once you've covered the basic things about respecting others, their humanity, those sorts of things. You have to be able to do that, in my opinion.
Sure, absolutely. Kurt, you introduced the idea, but what are your thoughts on these statements of policy and whether they do or they don't actually connect for the people delivering the service?
Well, I will go back to go back to finding out what are the purpose of these values, yeah, and who are the one who writes these values. When I've seen it done properly, I've seen service users' involvement from the core.
Yeah.
So they are very much pivotal in coming up with these values, writing these values up, and looking at it as a strategic part of the organization. So that's crucial to the process. But the other part of that process is about what about my values? How does my values get incorporated within that? Because I mightn't hold on to some of the values of another, yeah. But how that also get assimilated within the whole pile? And the other question will be, does these values remain there for life? Do we get a chance to reevaluate them? Does these values change after a while? Because certainly I don't like to think that we have set out these values and
sorry, Kurt, I'm going to have to tell you, you have to be kind for life.
but these are values.
And there must be some core values that don't change. So fundamentally, you're an organization or whatever you are, yeah, that has these core foundations that are based on the principles of kindness, dare I say, and being respectful of others. Those basic things that I think is what don't change. How you do it and how you deliver it is what you need to review, I think.
One thing I wanted to say is that is something that I think Rosalind mentioned. It's about how you measure it. How do you measure it? And that to me is, again, how you begin to evaluate it. Because if you can measure it, then you're in a better position to evaluate it.
That's true.
And
patient
also,
feedback and others.
Yeah, also, I think before any clinician moves to a job, you go into a job description, you see what is expected of you. You see what are the core values. There's always a mission statement for that organization. And before you join that organization, you would say, yes, these are some of the values that I hold dearly to my heart. And yes, kindness for life. So when you get to your journey of where you're going to deliver care, you must accept what those core values and policies are. And no, I don't think there's any nurse or clinician who I think goes through every single policy and guideline, but the basic and most important ones in delivering care and kindness and empathy, we must be aware of it. And if we are not aware of it, then what do we do? Do we need to train ourselves? Does the system needs to be revamped, updated in order to incorporate what these values are? So, it's a lot of question around kindness and empathy. It's not just words that we use like every day. When you're dealing from a clinical side, it's just almost, it's more input, I think, to the layperson on the street.
Thank you. Just for the record, I was playing devil's advocate when I was having a go at policy statements.
Absolutely.
I do think it is very important that we do have these statements, because what we're talking about in terms of kindness and in terms of empathy are things that I don't feel do change. These are what we should expect. I'd always come back to wherever we are, that's Trinidad and Tobago, that's the UK, that's anywhere in the world, as service users, as patients, we should have a right of expectation that we're going to receive a service in a kind manner, that people are going to be empathetic and try the best they can. I just want to, as we're drawing this to a close, I just want to come around each of you just very briefly to give a statement of what you feel the key message or the key messages are that you'd want the viewers, the listeners to take away. So if I follow the same pattern, Carol Ann, let's start with you. What would be your key message or key messages to take away about kindness, about empathy?
So I think wherever you are, whether it's in a healthcare setting, in a mental health hospital or an acute hospital, wherever you are, kindness is something that you need to think about, but also know that we are all in this together. Wherever people are, we are in this together, in this life and in this pandemic that we're currently experiencing. We are in this together. And if we can just do one little thing to improve someone else's life, I think together we could make a difference.
Thank you. And Rosalind, what's your message, the key message that you'd want the viewers or the listeners to take away?
Okay, it's been a privilege having to discuss kindness and empathy. But for me, for anybody that is listening to this webinar, I would reiterate that kindness and empathy must be a prerequisite to whatever you're doing, whether it's in the normal life, whether you're looking after patients. Just go that extra mile, just to show respect. Put yourself in that person's circumstance, in that person's shoes. Try to understand. Try to just do just a little bit more. And you would see it would have such a desired positive outcome that you yourself may be amazed. So let's just put kindness and empathy into whatever that we are doing. And that's the message I would like, whether it's Trinidad and Tobago, whether it's the UK or worldwide, whoever is listening. That is my message. Thank you.
Thank you. And Kurt, well, what's your takeaway message or messages?
I like to think that on the topic of kindness and empathy, we need to come from a point where we have a belief in humanity and mankind. So I think that core belief about trusting your human being, trusting your colleagues, I think that's crucial. Have that belief in humanity. I think we also need to be a bit more sensitive to others' feelings, their thoughts and their experience. And I think that bodes well for a lot of people who are coming through a difficult period with COVID-19. So this idea about being sensitive towards other feelings and the thoughts and the experience. And most importantly, I think the basis for me is about having that open, honest discussion. So when we have interface, it's open, it's honest, and it's on the basis of that we all trying to see what we can do to help support this person out of this difficult period. And the last thing I want to say is about we're trying to make this life a better place.
Absolutely. Absolutely.
Facts.
So all of this, with kindness and and be able to display it. It's about trying to make this.
You're disappearing on us.
Yeah, as I said, it's about making sure that we're trying to make this life a better place.
Absolutely. Yeah.
With acts of kindness and empathy.
Absolutely. Thank you very much for that. Well, time always runs away with us on events like this. It's been a great privilege to have been invited by TTHUF to chair this, and it's for me to perhaps summarise and capture some of the important messages just as we round off. I'd start by saying that there's a high degree of consistency across all of you in terms of what we mean in terms of definitions. So kindness, I would say, is something along the lines of a fundamental human quality. It's very much about being helpful. It's very much about being considerate. And I do think one of the important things is that we do no harm to people. That's always got to be uppermost in our thinking. Empathy, I did mention from the beginning, it's come up at various stages. Empathy, sympathy, these two things can sometimes be mixed up in mental health services. I get a very clear message from each of you that empathy was very much about understanding the feelings and experience of people, and that phrase that's most common, being able to put yourself into their shoes. So it's really about how you feel with another person, whereas sympathy is more about being like the other person. It's a sharing of the experience, a sharing of the feelings. That's the distinction I'd always keep in mind. Empathy is understanding, sympathy is sharing. I would say, in terms of practical takeaway messages, just at the very end, I fully endorse all of the messages that the three of you have just said. I would just like to think at a number of levels, from the service user and carers, we haven't mentioned carers so far, the service user and carer point of view, there was a point that Rosalind was making, which I think is very, very important, and that's give feedback to practitioners when you're actually receiving kindness and an empathetic response from practitioners. We shouldn't just expect that people are delivering these things and actually find the service user is experiencing it in a very different way. So feedback when people are being kind, just remind them, let them know. It's a very positive message that is very important for practitioners to receive as well. Staying with the idea of practitioners, wherever you are in the world, I would say self-reflection is a very important regular tool. We must be constantly thinking about how we communicate and how we're being received by other people. We should not take these things for granted. We should not just assume that we're coming across in a kind or empathetic way. It's important for each and every one of us to just keep on checking in, just keep on thinking about our responses to other people. And alongside that, I do think it's important that you, as an individual practitioner, that you check out with somebody else, one of your colleagues, check out within your team, have those discussions about these particular values from time to time. And whether you have supervision systems in place or you don't have supervision, I do think that is one of the important areas where we do have the opportunity for a working relationship to reflect on these values and to think about how they happen in practice, to reflect on them around very specific case examples that come up. So if you are not in a service with good quality supervision, and I'd say that goes as much for parts of the UK as it does for parts of Trinidad and Tobago, I would certainly be recommending that supervision systems are one of the important. We heard about training a little bit earlier. I would take it, drill it down a bit deeper. It's that one-to-one relationship with a trusted senior colleague that can help. And last but not least, we did touch on the organisation and the idea of policy statements, mission statements. I do think organisations, senior management have a responsibility to be conveying the messages that kindness and empathy should be at the heart of all service delivery. But we have a responsibility to say why. And we have a responsibility to perhaps communicate how we expect those things to be delivered, and not to leave it to what I said in the introduction as some random act that some people will receive and others won't. So it's one thing to have words in policy statements, that is important, but those words can be fairly meaningless if they're not really followed up and supported to be put into practice. So my last few words are to thank each of my 3 colleagues on the panel, to Carol Ann, to Rosalind, to Kurt. Thank you for your wisdom. Thank you for sharing your views and your ideas. And to also thank you, the viewer, the listener, and thank you for giving a bit of time and listening to these messages. We hope that there is something that you can take away. And until the next time, goodbye.